of you know that I came to Florida Hospital about 1.5 years ago from practice and a group of people over in Brevard County who helped me do similar work there. And by far, the day that we did this event in Brevard County was just the top of the year for me every single year. And so when I came here, if the marketing people are here, they may confirm this, that one of the first things I mentioned to them was, you know, we really need to have this caregiver event every year. And there were some very quizzical looks. What in the world do you mean? But very quickly, to Marjorie's point, the people of Florida Hospital, I've been tremendously impressed with their openness and their dedication to really living their mission, extending the healing ministry of Christ. It's an extraordinary group of people. And Dr. Guarneri's devotion really, I think, speaks very well to the mission that we all now share as a group. And so many, many hands went to put this event together today, and I couldn't be happier. So again, I've now got a highlight for the year, and it's right here in our home here in Orlando and Winter Park specifically, so I couldn't be happier. I also really like that when I came to Florida Hospital, one thing you notice when you work there is that many of the routine meetings, let alone a big event like this, many of the routine meetings are started with a devotion, a reflection, a thought about the work we do and about bringing our minds separate from the realities sometimes, the current happenings going on around us, maybe some of our own personal challenges or feelings, and they really serve to ground us in thinking about what we're doing there during that time. And keep that in mind. It definitely is something that I personally take away, and I think you're going to see a little message here emerge about the topic we're going to talk about too. Because that idea of sort of taking control of yourself and helping your destiny because of what you believe and what you want to make of yourself and your situation, that's an important part of what we're going to talk about today. So for me personally, I actually have a little prayer, a little saying that I wake up and start my days with, and so it goes like this, and it might sound a little childlike because we started it when my kids were little. So thank you, God, for another day of life so I can do good things for my family and the world. So just short and sweet, but really grounds us. Well, today, on my way here, said my little prayer, and I said, and get to talk to a few caregivers today. Because for me, my boss, who keeps track of how many patients I see, is here today, so don't tell her, but one of the things I love even more than being in my doctor's office is being here in a room like this. So to be able to come and talk with caregivers is really very important. And so that, any caregivers here? So my day is set, I'm in front of caregivers. But now here's the challenging part of liking to talk with caregivers. They don't always have the most uplifting things to say to me. Right? Any caregivers here feeling any stress? No hands, but lots of chuckles. Okay, some hands. Yeah, I mean, this is not an easy thing. But any of you caregivers who are feeling any stress at all, I want you to take a deep breath. Now, a few minutes ago, as I was starting my talk, everyone was breathing. But were you thinking about it? Did you know why you were taking a breath? Did you know that you needed to take a breath? No, it was just a very automatic thing. I'm going to take you to med school now. So here we are, back in Anatomy 101. And breathing is actually one of the automatic things. Our brain stem, the sort of controller of the body, sends that message to us. Our chest wall expands. Air flows through our mouth into our windpipe. And in the lungs, a really important exchange happens. So the air comes in, the tissue of the lungs sends the oxygen into the blood that has come via the heart. And they kind of match up and pass each other. And the blood takes away that important molecule, oxygen. It's really the elixir of life. Every single cell, tissue, organ, everything about us needs that one thing, oxygen. As the oxygen, as we breathe it in, everyone, you can never go wrong with taking a good deep breath, so just do it again. As you've done that, the blood that was coming through the heart, the blood that got that richest, the biggest, shot of oxygen, that's got some nutrients for the body, I'll tell you. Where do you think that goes first? The brain. I got someone up here guessing the brain. Thank you for, I always appreciate a volunteer. Thank you. She volunteered that the brain gets the blood that's got the best supply of oxygen. Anyone else want to vote? The heart. It is the heart. It is the heart. Now let's think about it. What does the heart do in the body? What does the heart do for the body? It pumps. It supplies the rest of the body. So it kind of supports the rest of the body. So it's itself, but it's a supporter of the rest of the body, okay? Where else does it send? You already said our answer. The brain especially. It makes sure that the key organs have the right amount of blood. So it's making decisions about where to send what kind of blood. So it's its own function, but it made a decision. It knows that it has to decide how much blood to send over here. It's got to make some decisions, make some close calls. But in the end, it decided, I just might need to take that oxygen-rich blood a little bit for myself before I send the rest of it on to the body. Sounds like a caregiver. Sounds like what a caregiver should do. The caregiver, just like the heart, needs to decide that it itself is important enough to the lives of both themselves and their loved one that they might need to take a little bit of that extra rich oxygen out of the blood and take it for themselves. Everyone who thinks that they're worthy of that extra oxygen, take another deep breath. That's the beginning of the idea behind knowing that you as a caregiver, if you don't decide to take your oxygen first, will the world around you, come up and say, oh, here, caregiver, let me help you. Let me help you, you poor caregiver. Outside of this room and all the people that work with us, did someone walk up to you today and say, or in your doctor's office, better yet, did your doctor say, are you a caregiver and should I take special precautions with you? No. Who is going to make those decisions? That's going to need to be you. You've all been on the airplane, right? I'm your flight attendant today. So when I say take a deep breath, that means you put that mask on and you take a deep breath. Anybody here thinking about their loved one right now? Anyone willing to admit it? Raise your hand. I know you're there. Very good. All right. Take your oxygen first. Deep breath. Get your mind focused on you. If you don't, what happens if the heart doesn't take its own oxygen first? Oh boy. That's right. Did someone just say code blue? That's what came out up here. I don't know what was said back there, but that's what I heard. So, and there is some truth to that too. So whoever said that. So from here on out, you're here today for you. The message I'm going to talk about, I might say some things about things that affect people from a medical standpoint, but it's all meant to be advice for you. If you find yourself with your mind wandering, I want you to pull yourself back, take a deep breath, and refocus on this 10 to 2, 10 to 3, is for you. And I am very glad you came along this day with us, but I want you to be focusing on you. Everybody ready to do that for me? All right. Part of the reason you have to do it for you is because you have to do it for you. I mentioned the question about, well, did the doctor know? And sadly, what percentage of time do you think a caregiver is asked by a physician how they're doing in their role as a caregiver? Any guesses? 0 was the guess from the front of the room. Everyone's agreeing. There's a hand in the back. How many times? Oh, she's holding up a 0. Yeah, and of course, another big fat 0 comes up. And of course, that's a sad reality. The real statistic, I'm happy to say, is 16. So that's something. I'm a glass half full kind of gal, so it's 16%. But 16% of the time obviously isn't enough. And I'm going to read this. Husband and wife here. Both of them feel confused, frustrated, and helpless. Only one of them has Alzheimer's. So that's the reality, is that most family caregivers feel unsupported, probably feel quite alone. In our room here, we probably have a pretty good mix, although the average, well, we definitely have a good representation of the average caregiver. Not that any of you are average. We're from Lake Wobegon. You're all above average. The average, though, is a 45-year-old woman who's also caring for some younger children, who works full-time and is helping take care of at least one, if not 2, of her parents. Now, 60% of the time, caregivers are women. But I almost feel like having the men stand up and letting us applaud you. Because men right now make up about 40%. But I used to say, and it probably is changing some now, but I definitely used to meet more daughters-in-law than I met sons. And so when I meet a son, I often point out to them, I'm really happy to meet you, son, and you must be a really fine son, because it just doesn't happen as often. So thank you, everyone, for being here. All of you, male, female, all of us are, as caregivers, are adding on to our own lives, aren't we? So in the 10 or 15% of caregivers who are also spouses, we have the added challenge that some of you are entering the caregiving role, not in that I gave you the average, but 10 or 15% of us are caring for our spouse. And we ourselves are in an older category and have challenges ourselves, perhaps from a medical standpoint. Challenges of aging. Have you heard? Aging is not easy. So there's things that happen. And so 10 to 15% of the time we're dealing with that stress in addition. And it is very well known what is going on with the patient. It is less well known what is happening to the caregiver. Case in point, everyone here I know can tell me immediately what disease the individual, our late great President Reagan, suffered from. What did his wife have? Now, occasionally someone tells me breast cancer. I think maybe that was in her history. But in addition to that, if she was like an average caregiver, she was at risk for deconditioning, weakness, physical injury, and I'm glad you're sitting while I'm telling you this. Sleep disturbance and fatigue, memory impairment, malnutrition, worsening chronic health conditions, new chronic illness.
What is deconditioning?
The question was, what is deconditioning? And deconditioning means that you can't do as much physically today as you could at some time in your past. So not being able to walk as far, not being able to go up a flight of stairs that you used to be able to go up, not being able to do open different jars that you used to be able to open in the past. Just a little less strength overall and endurance. So no one who's caregiving needs to be deconditioned. You know, no one needs any of these things added to the already challenging aspects of our bodies getting older, right? But these are definitely things that can happen. And unfortunately, the research tells us that caregivers are a particularly vulnerable group from the standpoint of the type of health conditions that they can be subject to. A study that I found particularly disturbing, I guess is the only word to use, was when they looked at a caregiver. This was an older caregiver and spouse pair. And the patient was hospitalized, and after hospitalization, they followed that pair through their life for another year or so. And they actually found out that caregivers of a patient who's hospitalized, who then goes back home into a caregiving setting, actually have a higher risk of getting sick or passing away sooner than a person of the same age who isn't a caregiver. And make sure you heard this correctly. They weren't the one in the hospital sick. They were the caregiver of the person who was in the hospital sick. The chronic stress of caregiving is something we are just now beginning to understand what the range of impacts are on the body. In the Take Your Oxygen First book that you received, the Lisa Gibbons family tells the story of taking care of their mother. She had revealed her Alzheimer's diagnosis the day of her mother's funeral after having passed away from Alzheimer's disease. Lisa and her two siblings, along with their father, took care of their mother. One of the main problems that they ran into came when their father could no longer physically take care of mom. The story goes, one day we were walking by the lake. She slipped and I fell, and I could barely lift her up. I wrenched my back in the process. His word was wrenched. The doctor, after looking at the MRI, called it 3 slipped discs. That was the wrench. That subsequently took Mr. Gibbons out of the picture from a physical standpoint, and at that time there were some physical needs. So this is an example of the type of challenges that we can all face from a physical standpoint as caregivers. So where's the oxygen for that? Well, the oxygen for that comes from things that you decide to do to make sure that your physical health is attended to. Now, you don't have to admit this. I won't make anyone admit this publicly. But I have had caregivers tell me, in fact, they've done it with our schedulers. I've had patients who I see both the husband and the wife, and I'll have a wife call if the husband's got Alzheimer's disease or is the more sick of the two. I'll have the wife call and she'll say, you know, I have an appointment next week, but I would sure like it if George could have that appointment because we've got something to talk to you about. So you just give him my appointment. Anybody give away their appointments? Let's see, what's the other one that comes up? Well, yes, it's time for my mammogram, or yes, it's time for my colonoscopy, but, you know, Sarah needs her colonoscopy, and that's going to be a little bit more tricky, so let's do hers first. Sarah's the one who had a stroke last year. Let's do hers first, and I'll get around to mine. I'll get around to mine. No, that needs to stop. Raise your right hand. I promise that I will.
I promise that I will
attend to my own health needs.
attend to my own health needs
in addition to my loved one.
in addition to my loved one.
And you're going to get some advice later on today, but in general, you know, one of the things I tell everybody is if you're the type to make your New Year's resolution or your start of your list in January, the first thing you do January, the first Monday of January, is you call the doctor's office and you get on the schedule for your annual wellness and an extra visit for other prevention or other needs. You get on the schedule, and those days do not change, and they're for you. If you don't do that, time passes, and there's a lot of things from a healthcare standpoint that can get missed. In addition, the other thing that this particular story brought out was, and Dr. Guarneri referred to it, there is an awful lot of autonomy going around in the American culture, isn't there? We all, you know, want to do it ourselves. That's just the way we're wired. This is not one of those situations where it's best for you to do it yourself. One of the reasons I love this setting for a caregiver event is because it's important to know who are the people out there that are available and able to help give you some of the information you might not have even known you needed. And when the time comes, provide some of the help that you need. And knowing that those resources are out there is kind of the first step to being able to then accept it. But it's still hard to accept it. And so you're going to have to, that's an example of taking your oxygen first, is saying, okay, it's not my natural inclination, but I'm going to go ahead and call someone and find out what I need to do. Because I've got to make my doctor's appointment next week, and if there's no one to take care of my loved one, then I cannot cancel that appointment. All right, I saw a lot of right hands raised, so I hope we're through with this one. The danger from a caregiving standpoint does not stop with the physical. And I think that there is a lot of stigma and a lot of shame associated with some of the emotional burdens of caregiving. Now, first of all, there's a lot of stigma and shame associated with, unfortunate name, mental illness and emotional illness. Even those words, we all sort of think, oh, I don't want one of those. And to me as a physician, it's a sad reality that that's the case, because it's a different tissue, but it's the same pathology, if you will. It's one tissue not working just like another tissue doesn't work. And why one has to be a disorder that no one feels like they can admit, and another is one where you just pop a pill for it. I mean, why isn't hypertension something we're all ashamed of? But that's the reality. But here again, the prevalence of this within the caregiving population is even more difficult, because who wants to admit that they feel guilty, burdened, they don't really want to be a caregiver? Nobody wants to admit that. Who's going to raise your hand to that one? Well, we got a hand. And I applaud you. I do. Because none of us were born and raised and went through our lives and told, when you're 50 or 60, most of us didn't have families, in the United States anyway, didn't have families where that was a natural part of the progression of the family. Now, we can have another discussion another time about what should be or what could be or what would be ideal. But the reality is that they don't have Caregiving 101 in high school. Nobody taught you how to do it. Most of us didn't have family experiences where it happened. So many of us are sort of shocked when all of a sudden, you mean you want me to go to the doctor appointment? You mean if Dad's leaving the hospital, I need to be there and I have to talk to the doctor, and then I got to make sure he takes the pills at the right time? I mean, those sorts of things just don't sort of naturally occur to us. And those sorts of feelings are often the fuel for these statistics. I honestly, in my experience over the years, 50% stress and 60% overt diagnosis of depression, probably a little on the low side. As high as that sounds, not necessarily permanently, but episodically, because many of you are taking care of caregivers, or taking care of loved ones for a very long time. Has anyone been at it 10 years? Longer? Longer than 20 years? Yeah. 5 years? I mean, years. Years. Going back to my comment about chronic stress, years is a long time to have an effect on you. Depression, long time. These sorts of things are why one of the most important things I want you to get out of today is the idea that you've got some control over how you feel about the caregiving situation. Anyone feeling stressed right now? Here, I'm talking about it. Take that deep breath. You know, one thing about breathing is that there's actually therapeutic ways to use the breathing. So I kind of said it, and I meant it. I wanted you to kind of clear your mind. But there's actually been, Dr. Andrew Weil was one of the big people who promotes the idea of using breathing as a way to actually calm yourself. And there's been plenty of research that shows us that it can actually work. So does anyone know the 4-7-8 method of breathing? This is not like Lamaze. So this is kind of the opposite. So, but we can just do it. Anyone want to come up here and do it with me? Any volunteers? No? Okay, fine. All right, I'll do it. So what you're first going to do is you're going to close your mouth. And this you can do at any time, any place, anywhere. No one will even know you're doing it unless you make a big scene. But you can do it nice and quietly. So you're just going to close your mouth and you're going to breathe in to a count of 4 through your nose. So just everyone take a nice deep breath. Now, some people say you should close your eyes, other people don't, so it's completely up to you. Now, once you've taken that deep breath, count to about 7. Some people don't like 7, they use 5. And then when you're done with your breath holding, exhale, open your mouth, exhale, and make a little itty bitty whoosh sound. Kind of push the air to a count of 8. One of the most important parts of relaxation breathing is that you breathe in a shorter amount of time than you breathe out. And I had a wonderful nurse. I love nurses. I had a wonderful nurse the 15 years I was over in Brevard County. And whenever I would teach caregivers about breathing, she'd always come up after I did it and she'd say, "Oh, Dr. Laird, I've got a much easier way. Just tell him," she goes, "just tell him to do this." And then she'd do something like this. And she'd go, "I want you to take a deep breath in," and she'd say, so the patient or the caregiver would take a breath in, and she'd go, "Now that's breathing in all the pink." And then she'd say, now blow out that air," and people would go, blow it out. And she'd say, "That's blowing out the black." So she goes, "Breathe in the pink and blow out the black. Breathe in the pink and blow out the black. Pink for the good, black for the bad." So, just another way to sort of think through. You want to breathe it in and then get it out. And if the bad is someone said something to you that didn't sit well, or you think you made a wrong decision, get rid of that bad thought. Breathe in the good and out with the bad. All right, so now you've all been trained, at least introduced, to this idea of relaxation breathing. And it really does change people's physiology. If we go back to medical school, everyone remember from, and this is even in, I think most of us learned this probably, the fight or flight reaction. So I like this. So anxiety and stress can be a good thing, right? So if you're, about to be hit by an anvil falling on you, you want your body to respond. You want your body to have those stress hormones coursing through and telling the muscles to get extra superhuman and strong, and you want to have that impact. But you don't necessarily want that every day for, what was it, 15 years, 10, even 5 years? You don't want that. You really need to be making sure that this isn't projecting very well. It's meant to be my calm blue ocean. This is where we want you to live from a stress level standpoint. Yes, there are going to be challenges, but I don't want you to have that chronic stress where you spend all your days in trying to run away from the falling anvils that are coming at you from a caregiving standpoint. Now this also, can you guys see this? One of the things about caregiving that I think is most stress-inducing is, at least I've been told by a lot of caregivers that this is the case, is feeling alone and feeling like there's nobody who understands. Now some of that you probably came by from actually watching longtime friends just sort of not be comfortable anymore being with you. Maybe you're a couple, or maybe you're a single person now instead of a couple, and the dynamics of friendship can change sometimes as we get older and different things happen. So there's some reality to the fact that caregiving can be a lonely time. There's also the thought that no one will really understand what's going on other than other caregivers. And where are they? We don't wear a big C on our head. The doctors don't know, who knows where to find you? Now, how did you all find us? There are networks, there are places out there, aren't there? And that's part of what our display and our collection of people who do good things for older adults and caregivers being here today was about, was that you wouldn't feel like the lone tree. You would actually feel like you were in a big, beautiful, supported forest. a bonus to anyone who can tell me where that was taken. I personally took that picture, snap, then I turned around, snap, and took that picture. Anybody? Anybody? Georgia, no.
California?
California, no. No. North Carolina. It is in the United States, although not necessarily in the contiguous United States, if that helps. Hawaii. Has anyone been on the Devastation Trail outside Mount Kilauea? So there was lava in between. Whoops, wrong way. Oh, there was lava between this tree. I was standing on the lava line. So this side was this tree. Turned around, there was our beautiful forest. So I saw that, and of course I immediately thought of a caregiving application. I mean, that's how crazy I am. But seriously, why else would you take those pictures? So it was for my caregivers, because I unfortunately immediately put caregiving and lava flow together in my head. So I'm sorry, but some of you can relate to that, right? Right? All right. Well, clearly, we want you to know that you're surrounded and supported. What did I do? Oh, okay. We want you to know you're surrounded and supported, and we do know what you're facing. Now, does that mean we have a Does that mean we have a clear path for you forward, and we're always going to be able to say, oh, you have this issue? Go take care of it there. That's how we'll solve that problem. No, there's a very windy path. And unfortunately, from a health system standpoint, and I sort of was a little bit harsh on my fellow physicians, we don't always sort of get everything right. But I have to also add some kudos to Florida Hospital, and in particular the group around Winter Park Hospital that was responsible for allowing me to come into this community. And I'm very proud of the people that are there and the programs that we are starting with a program called Niche. And this one I'm going to go ahead and give a shout out to. You're not going to ever see it necessarily, but what Niche does, and through our wonderful clinical nurse specialist, who you're going to hear from in just a little bit, that program trains nurses in the excellence of caring for older adults. Because just like doctors, we don't get trained in specific care of older adults in medical school. Did you guys know that? No, I'm serious. I'm dead serious. There isn't a geriatric curriculum in most American med schools, even today. Now, similarly, nurses don't have specialized training other than Winter Park Memorial Hospital and the work that they've gone to expense and time, and they've invested in it. And that's why we're going to be able to do what we can do. So I applaud them for that. We also have the Central Florida's only senior-friendly emergency room. And we've got members of our wonderful staff here, other nurses, expertly trained in helping people in an emergency setting who are facing challenges and they're an older individual. Some of my colleague Diane Burns, the social worker, who is really just a huge asset to the Center for Aging and Wellness. How many doctor's offices have a social worker in them? You know, very, very few. And that's only because of the support of the hospital system. The Conversation Project, a tremendous asset to the community that was also brought to bear by the wonderful people at the Winter Park, there she is, Diana Silvey, Winter Park Health Foundation. And that's all about talking about advanced directives and end-of-life issues and all those really sort of not so pleasant conversations, though, that become so vital in especially our later years, but anyone who's facing a chronic illness. And then finally, there's me and my gang. on the bottom there. And what a blessing it's been to be able to have that practice. And not pictured there, I don't know how she got out of the picture, but Dalia Tirado is here, and she's our wonderful director who's allowed us to do, if you want to know somebody who wondered, what in the world are they doing in that doctor's office? This isn't like any doctor's office I've ever seen operate. Dalia was a wonderfully just open for it and just has been very supportive. So these kind of assets, we can't always promise that we're going to be able to go perfectly from A to B, but we're certainly going to be there trying, and we're going to keep going, trying to infuse even more of these sorts of helps for you. But I want to go back to what I said earlier about you've got to take your oxygen first, and you've got to make some of the steps to taking advantage of these sorts of things too. And so, you know, part of it is what we'll do, and part of it is what you do. And we hope we're going to make you feel comfortable and supported in going ahead and taking advantage of some of these resources. I started by talking about Florida Hospital and its dedication to its mission. And they really live that very well. There's a whole curriculum around the creation health principles. And I am very likely in a short time into 2017, we're going to have some creation caregiving materials, specific materials looking at the creation principles, but focused on individuals like yourselves who are following a caregiving path and want to do it. This is very much in line with what we're talking about today, taking care of yourself along with your loved one and not sort of losing that essence of you. You know, that's really one of the big challenges here, is that you're living two lives in many ways, in some cases, when you need to take on so much of the responsibility for your loved one. So we want to make sure we keep track of you. I have to again thank the Hospice of the Comforter folks. The book was a very long labor. I usually say of love, but it really was hard enough that just the labor works for it. So it took a lot to get that done. And some of you may be here helping loved ones who don't have memory loss, and you'll see in the subtitle it says, Protecting Your Health and Happiness While Helping Someone with Memory Loss. But don't worry, the book is still for you. There is a lot of material specific to that, but if you just take out the memory loss part, everything else in the book is applicable to anyone, any caregiver. So if you know people who are taking care of loved ones with any condition, we have families dealing with stroke and with multiple sclerosis and anything. Chronic long-term caregiving has a lot of similarities to it, and the messages in the book are very important for them too. And speaking of that, caregiver jeopardy time. What is 1,766,219?
The hours it took you to write that book?
I think that's the best answer ever. Give that man a prize. But you're wrong. It is, what are the numbers of family caregivers in Florida? Now, they're not all here. Where's Sarah? Sarah, I told you if we just marketed a little bit more, we could have gotten. No, but in all seriousness, I told you how much I really like interacting with caregivers. And so while I'm driving here today, I really did. I was excited. I'm like, oh, I get to go do caregiving today. But every single time I do something like that, I think to myself, how are we going to make sure that the people who could not come today, for every one of you here, there are maybe 4 or 5 people who wanted to come, but then they said, oh, but I can't. I don't have anyone to take care of. So one reason the video cameras are running is for those people. And so someday those people are going to be watching this and know that we are caring about you. So what I want you to do now, I know you're going to think I'm crazy, but I want everyone to just kind of wave a little bit over to my video cameras and just wave. And just tell everyone we're here for you. Good. That's just a wave and a smile. Thank you. Thank you. Because it is so important. I showed you the devastation trail. There are many caregivers right now on their own devastation trail because they haven't found their beautiful forest of support. So we need to be we need to have the megaphone, and we need to do things. So some of you are parts of churches, and maybe you could take some of this back to your church and do something. Some of you might want to start a phone club in your housing, community. There's all sorts of things. I learned so much from caregivers over the years. Many of you will have good ideas. And I hope Marjorie will tell everyone at some point today about her podcast option as well. So there are examples of things happening, but we have to get it a little bit more, get the word out. But we will. And you, with your help, I know will conquer a lot. I end most of my talks with this quote, and today it's certainly pertinent. The test of a people is how it behaves toward the old. It is easy to love children. Even tyrants and dictators make a point of being fond of children. But the affection and care for the old, the incurable, the helpless are the true gold mines of a culture. You are our gold mines. We will do everything we can, and we certainly look forward to going on this caregiving journey with you. Thank you.